Surgeons, doctors of Reddit. What's the dumbest thing patients have lied about? Do you smoke cigarettes? No, I quit. When did you quit? This morning. Part of my job is dealing with medical records. My favorite part is when you are reading the doctor's notes and you can tell they are fed up with the patient's bullshit from their tone. Patient in for routine colonoscopy. Asked if solids consumed in 24 hours prior. Patient confirms no. In process of procedure, several dozen kernels of corn are discovered in colon and cannot continue. Patient specifically instructed not to consume corn beforehand as this happened prior visit. Honestly, the dumbest lies are the one people who lie about how much alcohol or other drugs they use. Alcohol and benzodiazepine withdrawal can kill you. And if you use opioids from the street, then you likely have a higher tolerance and may need more medications in the hospital, so be honest. I truly don't care how much you drink, use, I just don't want you to get worse for something we can plan for and prevent. I had patients that truly thought they drank 3 beers a day. I had to explain that the standard drink we're referring to is 12 ounces of regular beer. They'd be drinking the tall boys 24 to 30 ounces of ice beer, another 1 to 2% ABV on top. You had to learn to ask follow-ups or at least define terms. A common one is about their smoking. Smoking is an enormous risk factor for fracture non-union, meaning a fracture that doesn't heal. When I walk into a non-union patient's exam room and it smells like a cigar den, I know they smoke. But they'll tell me they don't right to my face. Before signing them up for revision surgery, I'll commonly order a urine test for nicotine metabolites. Often it'll turn out positive and suddenly surprised Pikachu face. Edit. Lots of folks below rightfully commenting on how indicating you're a smoker increases your insurance premiums. This is true. However, the cost of complications after a surgical procedure would dwarf a lifetime of increased premium costs. I would still recommend that smokers be straight with their surgeons so they don't rush into surgeries that end poorly. I fell down onto my couch and a cucumber was sticking up between the cushions. It went right in. I hate it when that happens. P*S modification. The case was an elective above-the-waist surgery, and he denied piercings. However, when the nurse went to place the Foley, she found the patient had modified his penis and it was split, bifurcated with multiple piercings to look like a cobra. The nurse did not know how to insert the Foley. The piercings also limited the ability to use electrocautery. In addition, he also embedded a metal implant inside his testicle that looked infected with a possible abscess. Cancelled case. Called urology consult for infection, abscess evaluation. 1. Patient says to me, I was outside gardening while naked and I slipped. That's how a massive potato ended up in my ass. Anybody want fries while he is waiting to get it removed? 2. How did you get that stab wound in your abdomen? I put a knife on the kitchen counter and forgot it was there. Then I walked into it. 3. Me. Have you had anything to eat or drink today prior to your surgery? Patient no, with a half-eaten candy bar in front of them. Me. Are you sure? Because if you have, you could vomit upon going to sleep and it could enter your lungs, causing you to die. Patient. Then yes, I have. I had half that candy bar. 4. This one guy repeatedly used to come in saying he hadn't shit in 7 days. This would usually necessitate a rectal examination with a finger. That's why he kept saying it. Patient used to come in every time the new doctors rotated in, who wouldn't be wise to his tricks. 5. One guy came in feigning unconsciousness. Did not respond to even the most painful of stimuli. Some of these were pretty painful. Did not budge. We were talking amongst ourselves about intubating him. He then opened his eyes and said, "They did that last time, I didn't like it." Guy came in for a wound on his lower leg that he said came from a biking accident. X-ray revealed a bullet inside his ankle joint. The wound was from shooting himself by accident while holding a gun. Still don't know how he didn't fracture anything. Not considering the psychiatric and the boring answers, like people who just swear with all their heart that they're taking their medications when they clearly aren't, which is the vast majority, there's not much, really. Only one really unique comes to mind. It was a patient that was a really kind old man who always would talk a lot with us, telling stories, praising the beauty of everyone in a tender and respectable way, saying how really grateful for our work he was and so on. Said old man would always appear with really high blood pressure values, even though he would swear that he always used his medication correctly. And after we did so many changes with his medication in many different ways, it's only natural to think that there's some problem with how he's taking them, if he was doing it at all. However, one day, after noticing that he would always go to the bathroom before even reaching out to the receptionist, someone discovered he would always eat a load of pure salt before being seen by any of the doctors, trying to make his pressure intentionally go sky high. Later we also, obviously, discovered that he indeed would not take his medications correctly as well, in order to obtain this result again and again. Turns out he suffered a lot from loneliness, and he was an old man that didn't have much contact with his family anymore. But mostly because his family didn't reach out to him almost at any given time, even though everyone lived close by. And in his desperation, sustaining dangerous high blood pressure was the best way that he had to obtain human contact within the emergency every week. This was the most odd one, but it's really common in general among elderly patients to appear lying about their symptoms, only trying to gather some attention and a private minute to speak about anything else. Most of the time they book an appointment only to talk about recent trivialities, which makes them clearly better. Although by the end of the talk, it's also easy to see how they gather back part of the sadness that the loneliness bring to them. Around my patients, at least, it's common for many to cry as they leave. Loneliness is a hell of both a simple and complex problem, and one that no one should be bound to live with. This one has broken my heart, that poor old man. Their age. Had a woman say she's 30 when she clearly didn't look it. Oh well, I move on to other questions. Look at her files and lab reports have her real age on them. 41. Like why though? What difference does it make lying to healthcare staff? This is health related, not your Tinder profile. Nobody's going to see this and go, I ain't dating an old lady. BTW, she was married with children. I had a lady tell me she had no idea how she got a rash she had on her face. I left the room, gave report to the MD, and when I walked back in with the doctor she looked at me and said, I didn't think you'd be coming back in the room. And then proceeded to confess that she'd been cheating on her husband and thought she had herpes. She did not have herpes. It's not so much a patient lie as it is me being dumb, inexperienced and uncomfortable asking necessary questions. I had a hypothetical patient during residency that was a very manly veteran and I was admitting him for rectal bleeding. He was in the age where it more than likely colon cancer, so I didn't think it was necessary to ask a sexual history. Folks at this particular establishment were known to at times be homophobic, and I had been yelled at by patients previously for asking, do you have sex with men, women or both? It ate away at my conscience, though, so I went back in absurdly nervously and asked him. He answered, son, I'm as gay as a rainbow. I've been at the bathhouse for the last couple of nights but I wasn't sure how it would go over to admit it. That's when the bleeding started. It was a very important lesson for me. My dad neglected to mention he had no teeth. Since 1976. We found out in the ICU. In 2022. One of my favorite things I wrote my first year out of medical school. Please note patient has stated multiple times that he wants to leave and would leave armor against medical advice. He asked multiple times whether he could eat and stating he is hungry. Explained to patient that we would like to start a full liquid diet first and if he tolerated it well, would transition to regular foods. However, PT ordered Chinese food delivery instead. Then, patient was complaining of a headache. Was given Tylenol for the headache. Patient stated that this did not help him. His sister at bedside went to the nearby pharmacy and bought goody powder, aspirin. Sister did ask whether she could give him goody powder. She was told not to give patient the goody powder. She supposedly did not. For context, the patient had a catastrophic GI bleed from taking too much aspirin. Since you included surgeons, I'm expecting someone to pop in and talk about all the patients who lie about the no eating 12 hours rule, or unclear on the details. Had gastric sleeve surgery several years ago. 2 weeks before surgery you start a liquid diet to shrink your liver or the fat around your liver and make surgery easier, also makes recovery easier. Psychologists shared that one patient had food in their stomach when the surgery was started. So not only did they not do the liquid diet, they also ate 12 hours before surgery. This was part of our discussion of how they decide who is ready for surgery. They all felt this patient was ready, was compliant, etc., and day of surgery totally blew it. The surgeon stopped the procedure on this patient and closed up. I was shook. It was such a journey to get to surgery, it would have been devastating. I had an endoscopy and my doctor yelled at me in the recovery room for not fasting since midnight. But I had, and my boyfriend backed me up, explaining that I had even set an alarm for 11:45 to eat and drink before midnight. Doctor didn't believe us. If he had, I would have been diagnosed with gastroparesis nearly 5 years earlier than I was. He's an asshole. Nurse here. The absolute dumbest thing patients have said. And to be fair, this was the patient's parents since I was in pedi, but still dumb AF and caused no end of grief trying to unspin it. I was rooming patients and I went to the full lobby and called the next one in by last name. They stand up and mom and dad bring the little girl back. I'm rooming them, take the vitals, review purpose of visit, make some adjustments to the chart. Also update their pharmacy and allergies and go out and let the pediatrician know they are ready. The pediatrician goes into the room and come out like 3 minutes later and says, "That's not my patient. Where is my patient?" I'm like, WTF? I go in and ask the parents and no, in fact they were not the patient. I'm like, why did you say you were someone you were not? They simply said they didn't want to wait, so they just came back. We had to completely unspin all the changes to the chart and had to get legal involved to make sure there were no HIPAA violations, which fortunately, there weren't. I'm fascinated that people can collectively think, yeah, let's do this, no one will know. Like, how does that even play out in their minds? One dude lied about being paralyzed after a lumbar puncture. Get a call from nurse, patient says he can't move legs following a lumbar puncture, spinal tap. I called the team that did the procedure and they assured me there was no indication of this sort of injury happening during the procedure, but agreed with my plan to get an urgent MRI. I go to examine him and nurse says she thinks he moved one of his feet. Next thing I know, he says he can actually move his legs again, but they are feeling weird. Then this weird feeling turns into intense pain and he asks for intravenous narcotics, Dilaudid. I tell him no because this story makes no sense. By God, it was a miracle, I tell you, when this man walked himself right out of the hospital after I refused the IV narcotics. Also, the MRI was normal. Do you have any medical problems? No. So no diabetes? No diabetes. What medications are you taking? Metformin. For my diabetes. I facepalm every time. First baby, never pregnant before. New OB appointment. We collect everything and do exam. I put a speculum in and I see her cervix. After her partner left the room, I ask her again, and she says she doesn't want her new partner know that she's a single mom. Not dumb, but just very obvious on an exam that she has definitely given birth before. I left a note on her chart to not mention prior pregnancy in front of her new partner. Another on my gen surgery rotation as a medical student, removing objects from rectums due to unfortunate falls. Patient: I haven't drank alcohol in months. Patient's family: it's true, I've been with her the whole time. Me: Mom, your alcohol level is 325. Patient: impossible. I would never lie to you. Resident doctor here. This happened during my psychiatry rotation in medical school. I wouldn't say it was a dumb lie since the patient was mentally ill, but I would say it was the most memorable lie. There was a patient at an inpatient psychiatric facility for suicidal ideation. She constantly insisted that she had a mass on her breasts and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined physical exam, but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently this lady had frequented many doctors' offices with various complaints of an unspecific nature and would usually focus on breasts or vaginal complaints when she visited male physicians' offices. We diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had lots of issues, but we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously, so the patient wouldn't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her health problems exist, and her primary goal was the attention from medical professionals. If she actually believed she was sick, we would have diagnosed her with illness anxiety disorder, commonly known as hypochondria. My girlfriend was in a mood with me and I thought I'd cheer her up by juggling knives, and then I accidentally stabbed myself in the thigh. Said by 19-year-old patient. Not a single person in A&E believed this nonsense. I had a guy insist that someone else put cocaine and heroin in his urine, even after I tried to move on with the conversation. I'm just a med student, but a doctor shared this with us. She's a gynecologist, and this woman came to her complaining about how she hasn't gotten her periods in few months. And well, she was showing menopausal symptoms, and in fact she looked almost 50, but she kept saying she's only 30 and she can't have menopause. It has a funny ending. When the doctor asked if the woman had a kid and she said yes, he's 27 years old. Tears of joy. IDK why people lie about their age, but this was a funny story for the whole class. A guy got shot and came into Out Trauma Bay drunk, high around 2 a.m. with something like $5,000 in cash, and he told everyone he was on his way to donate it to a Dropbox at a local charity.